I'm Tyler Babcock, and I'm currently serving in my second year on the ENA Board of Directors. I've been an ENA member for over 10 years, and throughout that time, I've been able to serve in varying roles throughout the association. At the local level, I served as a chapter president. At the state level, I was able to serve as the membership chair, on the Board of Directors, and ultimately as the 2020 Pennsylvania State Council president. At the association level, I've been involved with the Lantern Award committees and the Leadership Committee, and had the pleasure of chairing both of those committees at the end of my tenure. Professionally, I currently serve as the Administrative Director at Robert Wood Johnson University Hospital in New Brunswick, New Jersey, where I oversee a team of directors leading the ED, a psychiatric emergency screening department, and a 30-bed observation unit. My career started in EMS nearly 20 years ago, and I've been an emergency nurse for the last 14 years in a variety of settings, from level 1 academic medical centers to rural critical access hospitals, and a few stops in between. My why is to continue driving a passion to advance the mission and the vision of this organization, and to keep building on the foundation that we've worked hard as a board to lay down. The last few years have been challenging for everyone in healthcare, especially nurses, and that impact is felt within our association as well sometimes. As a board, we're working to develop and cultivate strategy that ensures continued success of the association, all while we grow, learn, and reimagine how we can support emergency nurses. My leadership style, rooted in strategy, collaboration, and transparency, are a perfect complement to the role of Secretary-Treasurer. My background in nursing leadership, recent experience as a stretcher-side nurse, and academic preparation as a master's prepared nurse with an MBA in healthcare administration uniquely positioned me to serve in the role as Secretary-Treasurer. I like to say that I'm fluent in finance and have had the opportunity to share some of my financial acumen with the larger ENA community in recent years through lectures at ENA Leadership and EN24, as well as assisting to develop on-demand educational content for emergency nursing leaders as it relates to finance. These experiences and skill sets would allow me to truly serve in the role, assisting in setting financial strategy while also serving as a leader on the executive committee and embracing the role of a leader of leaders within the board. So the bylaws explain the role as the principal finance officer and secretary of the ENA. And while I do agree with that, I also think that it's so much more than that. It serves as a leader of the finance committee, a formal leadership role within the executive committee, and as an opportunity to continue to grow and develop within the board's leadership structure as an entry level to the presidential line of succession. It's a role that really requires the financial acumen and ability to build relationships, strategic vision, and the ability to have tough conversations, all of which I really think that I can bring to the role. The role also serves as the liaison between the operational arm of the association and both the board and the membership as it relates to financial performance and oversight. It's a key player in establishing awareness, accountability, and analysis of relevant data in a way that strengthens the organization and truly promotes transparency. If I were to serve in the role, I'd be committed to those principles to really ensure that transparency and accountability were the key tenets of our financial strategy moving forward.